Assalamu alaikum. The regenerative endodontic therapy is dependent on three principles, which is the stem cells, growth factor, and scaffolds. So in this paper, it is a review article titled with the treatment outcome of regenerative endodontic therapy in immature permanent teeth with pulp necrosis. It is a systematic review and network meta-analysis done by Mohammed Sabeti and his group in 2022. So the aim of this systematic review and network meta-analysis is to evaluate the efficacy of different treatment modality for scaffold selection in regenerative therapy for immature permanent teeth with pulp necrosis and determine the most successful approach. So in the bigger question, the population, which is the individuals with immature necrotic permanent teeth with open abscesses, and the intervention, which is the regenerative endodontic therapy, including all methods of the disinfections, all varieties of scaffold, growth factors, stem cells, and all types of sealing material used. And the comparison is the other regenerative endodontic therapy methods as limited by study design. And the outcome, which is the primary and secondary outcome. And the primary outcome, which is the clinical success, is defined if the elimination or resolve the clinical signs and symptoms are and also the observed of bony healing through the apical radiograph, and the secondary outcome, which is the evidence of the root development through the increasing and root wall thickening and root wall length and apical closures of anatomical apex. And the type of study design, which is the randomized controlled clinical trials with the three separate follow-up interval, which is 1 to 6 months, 6 to 12 months, and greater than 12 months. So from the database used, they identify more than 2,000 records, and only 9 studies were eligible in this research. So they including 290 immature permanent teeth in patients in age ranging from 8 to 28 years old, and only premolar and incisor they involved in these studies, and they involve also 6 modalities regarding the scaffold, which is BRF, which is platelet-rich fibrin and platelet-rich plasma, blood clots alone or combined with BFGF or combined with the collagen and platelets pellets. And the observation period, which is a minimum of 12 months, and we can see in the other study extended to 18 months in 3 of the studies. The result of this systematic review and network meta-analysis suggests that regenerative endodontic therapy using BRB or BRF showed the greatest success for achieving both primary and secondary outcome at 1 to 6 months, and that BRB or blood clot scaffold showed the greatest success for achieving both primary and secondary outcome at 6 to 12 months postoperatively. However, blood clot scaffold with BFGF or blood clot scaffold combined with collagen show the greatest success for achieving secondary outcome only at greater than 12 months postoperatively. So from this finding, we indicate that there is an acceleration of tissue healing observed in the short term, but the underlying mechanism needs further investigation. So there is a very low to a low quality of evidence suggests that BRB and BRF exhibited the greatest success for evaluating the primary and secondary outcome within 12 months postoperatively compared to the traditional blood clot scaffold protocol.